Okay, so welcome back everyone. Now in this video we'll be discussing about acromegaly. So acromegaly is an endocrine disorder. So this occurs due to excess growth hormone secretion after the growth plates have closed. So there is either pituitary tumor which causes excess release of growth hormone, and this is usually a non-cancerous condition. Mostly the age group which is affected here is middle-aged adults, that is around 25 to 45 or 50 years. So now we'll be discussing about the pathophysiology. So the pathophysiology here is that there is a benign tumor in the pituitary gland. So due to this tumor, there is an excess release of the growth hormone. Why there is excess release of growth hormone? Because growth hormone is released from the anterior pituitary gland. So if there is any tumor, the proliferation of cells, so excess amount of growth hormone will be released. So these excess growth hormone will then affect the body's bones and tissues and will cause them to grow in abnormal ways. But remember, the most important thing here is that despite the closure of the bone plates, the body's bones and tissues grow, and this will grow in an abnormal way. There will be a widening of the bones. So we'll be studying one by one that what will be the clinical features. So the first one is the gorilla-like face. So here in this video you can see this picture that there is a normal and there is the acromegaly face. So what happens in gorilla-like face is that you can see the brow furrow, enlargement of the base of the nose, then there is thickening of nasolabial sulcus, thickening of the lips, parotid hypertrophy, and prognathism, the widening of the jaw and protrusion of the jaw. So these all things are seen. In this lady also we can see prognathism, that is the protrusion of the jaw and widening of the facial bones. And apart from this, there is also disorders in the hands. So in the hands, if we see that the hands of this lady looks like spade-like hands, there is widening of the fingers. So acromegaly patients typically have these spade-like hands. Apart from this, the widening of the feet can also be seen. Patients also have insulin resistance, which may progress to diabetes. So here in this comparative flow chart, we can see that whenever there will be an excess release of growth hormone, there will be impaired feedback, and this will lead to decrease in the beta cell function, which will further lead to insulin resistance and diabetes. So treatment usually involves surgery, that is removal of the pituitary tumor, and radiation. And we also give many drugs, which is growth hormone antagonist, which will inhibit the release of growth hormone. And also, if not treated, then this can cause death. So what is the cause of death? The answer is neoplasia, cancer. So this was all about acromegaly. I hope that this video was useful. Share it with your friends. Okay, thanks for watching, guys.